we know that our gut health is a marathon, not a sprint. So we see that if you do amazing things for your microbiome for a month and then stop, it's just going to revert back to what it was. And you're not going to get those longevity benefits, those hormone regulation benefits, and all of that sort of stuff. So, what I would say is just thinking, what is one thing that you could then implement? Is it just focusing on that plant diversity, getting in at least 30, if not more, different types in a week? Or, is it actually focusing on each day getting something from those super 6 plant-based food groups?
What's up, folks? Do you know how many vegetables you should eat in a week? I didn't, but you're about to find out now. Welcome back to the Whoop Podcast. I'm your host, Will Ahmed, the founder and CEO of Whoop, and we are sitting down today with Dr. Megan Rossi, the gut health doctor. She joins Kristen Holmes, the global head of human performance at Whoop, to talk about everything related to your gut health. How do you know if you have a good gut health? How can you improve it? Important biomarkers to be measuring, the right type of nutrition to make you perform at your very best. That's the Whoop Podcast coming right now.
Dr. Megan Rossi, welcome to the Whoop Podcast.
It is an absolute pleasure.
I'm so excited for this conversation. I don't know that there is an aspect of health and well-being that is more noisy than the gut health conversation. I don't know if you agree with that, but to me, it seems like a really kind of the wild, wild west in a lot of ways.
Yeah, look, it certainly is having its moment. And I think with good reason. Like, it is a landmark scientific discovery that is game changing in terms of how we see food impacting our health. Like, we've always known, right, that food has a role in longevity, mental health, heart health, all that sort of stuff. We haven't had the full picture. We never really understood until technology allowed us to discover we've got these trillions of bacteria. And now we're like, oh, okay, that makes sense.
So just to frame up this conversation, I have two questions. So the first question is, and it's kind of just a yes or no, and then we're going to dig into however you answer this question. But do we have agency over our gut health?
I say yes. Yeah.
Okay, amazing. The follow-up question is, what is a healthy gut? So based on all of the years of your clinical experience, all the thousands of repetitions you have seeing patients, and just this has been your life's work for a very, very long time. How do you define healthy gut?
Yeah, someone who is not getting sick all the time, someone who's got, strong mental health, someone who isn't having digestive upset, someone who sleeps really well, someone who's able to deal with stress effectively. And that, as you know very well, Kristen, comes back to the fact that this discovery, these trillions of microbes, is literally connected to every organ in our body. And it's a game-changing sort of concept that is, worth the noise. But I think with anywhere where there is science, there's a lot of kind of charlatans out there and confusion and all of this sort of stuff that actually kind of, in my mind, kind of degrades the science in some ways, because people are so excited and passionate about it, but they get led down these ways where actually they're harming their gut because they're taking things or doing things that actually the science doesn't recommend. And that's actually how I kind of got into more of like public engagement side of science, because I think it's like that injustice to the gut. I like to, be very protective of the science and what we're saying about it.
I love that. Yeah. I mean, I would love to dig into just supplementation, because I think that is an area that's really confusing. I would love to know, what do we know and what do we don't know? So what do we not know? And we can dig into that in a second. You mentioned mental health, sleep, and a laundry list of areas that markers or kind of signals that help you understand whether or not a person has healthy gut. What about menstrual cycle? Is that a signal in some way?
Yeah, really, really interesting question. And you probably know, Kristen, that women's health sadly is under-researched. So a lot of the research today has been done in males. But what we do know is that it seems to be a bidirectional effect. So we know that hormone fluctuation can impact our gut health. And you probably have experienced yourself, like period poops, like looser poops around your periods. And that's because the hormones are changing gut functionality and movement and stuff. But then equally, we know that our gut microbes can help actually regulate estrogen. So you may have heard of the term estrobolome. So this new kind of scientific classification of microbes that are able to help recycle estrogen. And therefore, we're seeing that they have a really important role in a lot of women's health, conditions, whether it, is something like PCOS, polycystic ovary syndrome, or whether it is like going through menopause, life stages. But absolutely, I see it in clinical practice, not just in the scientific world. We know how important, for women in particular, nourishing our microbiome really is for that hormone stability.
Do we see relationships to markers of kind of gut health? And you mentioned sleep. So have we been able to pinpoint specifically sleep duration, sleep consistency, sleep's quality? Do we
Yeah.
know what aspect of sleep is kind of impacted the most?
Yeah, I mean, we don't know the exact specifics. There has been scientific studies that shows that after 2 nights of sleep deprivation, and I think the clinical trial used, it was like 4 or 5 hours of sleep, actually their microbiome started to change. So we do know that there is kind of that impact of that sleep deprivation. I suspect sleep quality is going to be the same thing, right? Because if we're not having good quality sleep, then essentially our microbes aren't able to get that gut rest time to then kind of clean the gut and kind of focus themselves. They've got their own circadian rhythm, right? So it's not just like the human cells, they also need that rest and that time to sleep. But also there's been one study which looked at actually supplementing the gut with a specific probiotic actually seemed to improve sleep duration. So again, it is very mechanistic, but suggesting that it's bidirectional, right? So it's not just a case that poor sleep's going to impact our gut health. We also know that our gut health is probably going to impact our sleep quality.
Yeah, I love it. What got you into this work? You're so passionate about it, Megan, and following your work on Instagram and all of the research that you're engaged in, and the lab that you have at King's. It's really inspiring, and I find that for a lot of folks who are engaged at the depth that you are, there's something that's kind of underpinning that passion, and I wonder what that is for you.
Yeah, look, I think, like you said, for most people to work, most days and weekends, there has to be that passion there, right? And for me, so I grew up on a farm in Australia, so good gut health was inherent to my upbringing. Playing in the dirt, all the stuff we didn't know was good for the gut, we now see actually is amazing for the gut, reduce your risk of allergies because of the gut immune connection. But actually, I was in my final year studying nutrition and dietetics, and I lost my grandma to bowel cancer. And
Oh, oh.
I think a lot of people can relate. Like, it's the third biggest cancer killer in the world, but my grandma was really instrumental in my upbringing. So I had a single mom, and she was always there. So she was like my rock. And so I hated the gut. It took her. It put her through chemo, the surgery, and even talking about it just makes me feel so angry. At that time, I had no idea. I was like, this is a horrible organ. And then I started working as a dietitian. So I graduated, worked as a dietitian in the hospital setting, all different types of conditions, whether it was heart disease, obesity, mental health. But then also was very fortunate to be the nutritionist for the Australian Olympic synchronized swimming team. And it was that observation of working with elite athletes and very, very sick people, both of them coming to me complaining of the gut. And I'm like, what is it about this organ? Like, I
Yeah.
got it, the disease of my grandma's gut, fine, that kind of makes sense. But like, why is everyone else coming to me with this complaint? And that was like, 2010, 11. There hadn't been a whole lot of gut health research come to the forefront at that stage. So I thought, you know what, I owe it to my grandma and to my patients and clients to find out what's going on here. So that's when I embarked on the PhD. And it was that, like, it just completely changed my relationship with the gut. I was like, far out. I am so sorry for all of the swear words I threw at you, gut. Like, it was just misunderstood. And, we didn't know how to treat it. And that was, causing so much pain and hurt. So at that point, I knew I wanted to dedicate the rest of my career to the gut, because I could see, obviously with the PhD, but also, as a clinician, that actually targeting the gut was having these far-reaching benefits, not just, helping people with very frustrating and often debilitating gut symptoms, but, things like their mental health, their performance, lowering their risk of things like dementia, right? That you can't change your genetics. But that's why I said yes to that question. You can influence who's living in you and what they're actually doing, that we now see is impacting so many chronic conditions. So that's kind of what's kind of, gets me out of bed every day. And, I love research so much. So I would never let that go. And that's why that brought me to the UK essentially after PhD.
Mhm.
Hilariously, we did our PhD both in Australia, UQ.
Yeah.
But I knew I needed to elevate my research. And Australia is amazing. I love it. I told my mum I
Mhm.
was going away for a year just to establish myself internationally in the research world. But King's in London just are doing so much cool stuff, and
Mm,
the grants that we've been able to get from the government has been incredible. So it's kind of
mm,
kept me here 9 years on. So we're doing many, and we'll probably talk about some of the clinical trials we're doing. But I think the other side is that science communication, and I am so passionate about that because, like I said, we need to protect the science. We need the right science to get out to everyone, right?
mhm.
And not let it kind of be diluted by people who are probably saying not science-backed things.
Right, of course. Well, I mean, your contributions are remarkable. And, you mentioned the misinformation. I'd love to just start there, because I think if anything, if people are listening and they're deciding whether or not they continue to listen, I think it's as a public, kind of service, we need to make sure, what are the limitations of the research that exists
Mm,
as it stands today, right? And
yeah,
what do we know? What do we not know? Where are these gaps? And how are people erroneously filling those gaps?
yeah.
So I'd love for you to just try to unpack that for
Yeah, look,
us.
I think that's a really good one, because there is still so much we don't know about it, right? Like it is
Right,
such
of
an
course.
exciting space, but also there is limitations to it, right? So there's still, I would say like 30% of our microbiome, which we actually have no idea what these microbes are called, what they're actually doing. And so most of the research so far has focused on the bacterial component of the microbiome, right? But actually, we've got a viral component called the virome, and we've got a fungal component called the microbiome. And these elements we've just so under research, which actually they're like synergistically working together with the bacterial component. So there's all of these like interconnections, which we've got no idea or no understanding of what's actually happening. So, you know, um, in clinic, a lot of people are coming to me with these microbiome tests done, and they're like, "Here's my results. Now tell me what I need to do." And I'm like, I love that you're so interested in the microbiome, and I think it's cool that you've got your microbiome tested to have a look what's there. But like this is so primitive in terms of actually where our knowledge is at. So of course, like in our clinical trials at King's, we do these microbiome tests, but we're not just looking at the bacteria there, we're looking at the metabolites. So, what's actually going to happen in terms of the functionality, right? So we don't just want to know
Mhm.
what bacteria, because identical bacteria can be in two different people's guts and treated differently. And in one situation, they can be really healthful and anti-inflammatory. In other situation, if they're not treated well, they can be pro-inflammatory.
Mm,
And also it depends how they work with the fungal component, right? So I think we can be led astray by a lot of these kind of commercial tests on the market. I think
right.
probably give us 5 years, we'll know a lot more. And if you've got the money and you want to investigate it, go for it. But don't
Mm,
think it's going to give you like this personalized diet, because
mhm.
we're just not there yet. I do hope we'll kind of get there. But actually, Stanford University have just published a cool paper highlighting what you said, like what is a healthy microbiome? And it showed, I think they followed like 86 people over 6 years, because we don't really know transiently what happens over time, right, to our microbiome. And what they showed is those who maintained health over those 6 years, actually their microbiome is all really unique to them. So there's no like perfect microbiome based on the types of bacteria. I should mention that study literally just looked at the bacterial component, because that's, we're not really at the stage of being able to look at the viral component, the virome and the microbiome together yet. Yeah, so it was really like a bit of a moment, I think, to be like, guys, there's no like perfect thing we should be searching for, that we should be uniformed. Like everyone's got their own unique microbiome. So if you treat yours well through the diet, through the sleep, through the de-stressing, through the exercise of, the
Mhm.
pillars of gut health, then actually you're going to have your unique combination that will then be super resilient, look after you, help you perform at your best.
Amazing. So you mentioned metabolites is the best way. So if we're doing kind of a fecal test, a commercial fecal test, a commercial blood test,
Yeah.
is that enough? Because I guess if you're measuring metabolites, you're looking at plasma. So are the commercial tests actually doing that? Like what are the actual limitations?
Yeah, so there's different ways of measuring metabolites. So obviously the plasma, we can look at it there. We can also
Mhm.
look at the volatile organic compounds, so via breath, and that's actually based on a clinical trial we did at King's where we looked at how people responded to certain probiotic and certain diet, right? And we showed that actually the bacteria they had in their gut, so the names of the bacteria like bifidobacteria, lactobacillus, all that sort of stuff, didn't predict how they would respond to the diet or the probiotic. What
Hmm.
predicted it was those volatile organic compounds. So the chemicals the bacteria are producing that were then able to breathe out. And then also in your stool, right? So your stool have got these volatile organic compounds. So
Mhm.
when they, you obviously pass the stool, then they can isolate the ones that evaporate. So volatile, obviously, where's the name comes from. And it's kind of those profiles that are starting to be used to, predict how people will respond to different diets, treatments, but also maybe even be a marker of different conditions and diseases and things like that. So in terms of, I guess, the commercial tests on the market, sometimes they look at a couple of metabolites, but they aren't doing these comprehensive,
Mhm.
networks of metabolites yet. Hopefully, we'll get there.
How transient is the picture of, like, blood or feces? Like,
Yeah,
and I think if I go to the doctor, if, a lot of time it depends on where I'm at in my menstrual cycle. It depends on how much sleep I've got over the last 7 days. It depends whether I exercised or not. There's a lot of things that impact, I think, those tests and those readings. So, how do you get, like, a true picture of gut health?
yeah,
You know?
Kristen, this is so spot on. And like in all our clinical trials at King's, I always say that part of the protocol has to be like the meal the night before needs to be standardized,
Totally.
at
Yeah.
baseline and end of intervention, because we know that, our microbiome can change, within a couple of hours, essentially, what you're feeding it, right? Not necessarily the number of different bacteria, but certainly the metabolites. So again, that adds to the picture of we don't quite know. If I was to look in a crystal ball, I think it's going to have to be, you know, one or two microbiome tests over a space of 6 months on the monthly to have a look at what's going on. And what we're certainly seeing is stability is one of the key markers. So
Mm.
yes, we know diversity is important, but actually stability as well. So if you have a nice stable microbiome, that just constantly, tracking similar ratios of microbes, similar metabolites,
Mhm.
you are much less likely to get different chronic diseases, as well as, things like the cold and flu and stuff like that. So, yeah, they're kind of the two things we want to look for at that, the stool level. But again, like I
Mhm.
said, the metabolites, I think, is what really excites me, but we just don't
Mhm.
have all of the science yet.
Right. And would you say, how foundational is this type of testing, right? Like I don't know that many people have a clear picture of their gut health, right? They might have in they're like, "Oh, I have a really irregular menstrual cycle," or, "Oh, I have insomnia," or, "Oh, I have loose stool," or, I'm constipated," or,
Yeah,
they
yeah,
might
yeah,
have all of
yeah,
these
yeah,
kind of
yeah.
symptoms, but are they actually connecting it to gut health? Like, where I guess I wonder what those conversations with a PCP
Yeah.
are. How do people think about you know, or would you say, and not to lead this conversation too much, but like, is the gut really at the foundation of a lot of the issues that you see?
Yeah. I mean, yes, it is. But that question is certainly one that I, get asked all the time. Like, how do I know if I've got a healthy gut? Oh my God,
Yeah.
it's linked to things like, longevity, your mental health, all the things that I
Mm.
want. So how do I know where I'm at? Right. And unlike kidney function, heart function, where we've been able to come up with, a marker essentially, we haven't gotten there with gut microbiome for two reasons.
Mm.
One is that it's still new, right? We've only recently kind of got the technology that's enabled us to kind of identify not just what bacteria are there, but the functionality, the genomics, what their genes are capable of doing. So I think that's kind of a limitation, but also the fact is that it is very complex, unlike every organ in the body. And yes, most organs are talking, but actually we're appreciating is the gut, because they produce metabolites, is probably more central in terms of their ability to influence every other organ. So when I was writing my first book, I was like, how can I, because people are going to ask me this question. I know they are, and I
Mm.
need to deliver it in a book. So I came up with 10 questions essentially, and we can put it in the show notes, completely, free to access the
Amazing.
quiz, but it asks people 10 questions. So are you getting gut symptoms? How often are you sick? Are you stressed? What's your sleep like? Are you on medications? are you on a restrictive diet, and a few
Mhm.
other things. And it scales you from a 0 to 20 as to where your gut health might be. Now, obviously, it's not hugely comprehensive, but I have certainly validated in clinic, and it does give a decent predictor of probably where your gut health is at.
Mhm.
And hopefully, like, I think people take away from it is like what areas of their gut health might they need to focus on, right? Because I see it all the time in clinic. People are like, I just want to focus on my gut, my diet, because I feel like a lot of high performing people in particular, they like super OCD, perfectionists, they can control their diet. But actually the stress, the sleep, the exercise kind of gets pushed away. And what I
Mm.
always say to them, no matter how perfect your gut boosting diet is, if you're failing the other three pillars, sadly, the science is showing, you're not going to have the optimal gut health that you kind of deserve. So you
Right.
do need to be more holistic.
You mentioned markers, right? We don't have a great marker.
Yeah.
There's been some recent research basically showing a relationship between heart rate variability and gut health. So I
Yeah.
think this is really exciting, right? And of course, at Whoop, we measure heart rate variability. And in this paper, they found that lower HRV, which we know is an indicator of a less flexible autonomic nervous system.
Yeah.
And I'm very biased, but I feel like the pathway to human health and functioning is having control over the autonomic nervous system, right?
Yeah.
Via all of these levers that we're going to kind of
Mm.
talk about today. But they said that the folks with lower heart rate variability are more likely to have gut dysbiosis. So what exactly is this? I know it's an imbalance in the gut
Yeah.
microbiome, very, my crude understanding of it, but
Yeah.
what exactly is that, and how do people get that, and how can they, and if they improve it, would we see their autonomic nervous flexibility actually increase and improve?
I love that you've highlighted that study and that Whoop is actually starting to measure it, because I think there is
Mm.
definitely something in there in terms of that tapping into this gut brain axis, right? So,
Mm.
like you said, our brain and our gut are constantly communicating via what is known as the enteric nervous system. People probably heard of the vagus nerve, hundreds of millions of
Mhm.
nerves innervating and connecting the two. But also, we know that our microbiome produces different types of chemicals like short chain fatty acids when they metabolize foods. Some of them are thought to pass that blood brain barrier, also affecting obviously hormone regulation, things like cortisol release, and those sorts of elements. So, as well, and of course, the immune system, 70% lives in the gut. So it's impacting the immune system's ability to release inflammatory markers. So I think that's kind of like an alarm system. The microbes like sensing, activate the immune system, inflammation goes throughout the body and has that impact on heart rate variability as well. So in terms of the dysbiosis, I'm not even slightly surprised that kind of that imbalance. And again, it is a very loose term in terms of what
Mhm.
dysbiosis is. So how we kind of come up with that is every study dysbiosis will be slightly different, because they just compare healthy and those who have a disease state, or those who in yours,
Mm.
like mentioned, they have irregular heart rate variability. And it's those kind of groupings that shows actually they don't have as much diversity, or they're missing some key microbes.
Mm.
So absolutely, I think if you do notice, your heart rate variability is not, optimal, then focusing on those pillars just for a month and see what happens. And, there has been a few, I don't personally measure it, but one of our psychologists at the Gut Health Clinic has been measuring heart rate variability, and showing that by getting that down through different techniques of, relaxing that gut brain interaction,
Mm.
whether it's gut directed hypnotherapy or gut directed yoga flows or that sort of diaphragmatic breathing, etc., actually they've really been able to improve gut symptoms. So they haven't actually measured the microbiome for the dysbiosis, but yeah, that sort of thing. So it is a really exciting space. And that's what
Mm.
I think is going to happen more and more. We'll appreciate different markers of the gut, which on their own is not going to be like the number one marker of your
Mm.
gut, but actually it's combining all these other things, which will actually start to piece together and give people that insight that they so dearly want and they should have, right? To know
Yeah.
where their gut health is at.
Yeah, and I think if, I get a lot of folks who are like, gosh, my HRV just is, not really improving, and I'm doing everything related to sleep and exercise, but I think the lever maybe that they're not leading into enough is maybe the food, right? Maybe they
Yeah.
have the wrong kind of program for them, or
Yeah.
their diet isn't diverse enough. And so I want to talk about sleep, and I want to talk about exercise and supplementation, but maybe let's start just with food, right?
Yeah.
What do we, if we're really striving to have this kind of healthy gut per your definition,
Yeah.
at the onset of this discussion, what does that that diet actually need to look like? And, what are the basic
Yeah,
principles?
look, where the science is currently at, it shows that people who eat more different types of plants seem to
Mm,
have better gut health than those who eat the same 10 on repeat. And I think a lot of people are starting to hear this concept of plant diversity, but I think it's important to understand why that's, something we should take note, because I think when people know the why, they're more likely to take it on board as a strategy, right? If someone just says, do this, Megan, I'm like, I'm not going to do it unless I know why. So if you think of a superfood like blueberries, right? So if you just ate loads of blueberries, you're only going to feed the gut bacteria that like blueberries. But actually, our gut bacteria like us. There's thousands of them and they all have different preferences, like taste preferences. You and your friend might like different foods, right? So if you're just, narrowing down and having, some superfoods and not eating across what I call the super six, you're actually going to only nourish a minority of your microbiome, which means you're going to have a minority of skills within you because they, can do tens of thousands of things in a functional level. But if you're not feeding them well, they're not going to be able to perform, like most of us, right? So if you think of, I mentioned the super six, so there's 6 different plant-based food groups. A lot of people know them, but actually it's worth thinking about, hey, have I had something from the super six today? Because most people don't, right? So it's your legumes, so things like your chickpeas, butter beans, etc., your veg, your fruit, your whole grains, your nuts and seeds, and your herbs and your spices. Now, each different category actually contains different types of not just your micronutrients, but actually different types of fiber. We talk about fiber like it's one thing, but there's like close to 100 different types of fiber, let alone these other things called phytochemicals. And like just take your boring old apple, right? It contains over 300 plant chemicals, including things like inositol, which we know is helpful for PCOS. It's got even some melatonin and some dopamine, the feel-good hormone. And that's just like your boring old apple. So if you extrapolate that out to all your other plants, you start to get the appreciation that each plant's got its unique kind of profile. So instead of every morning having your blueberries, switch it up with your 3-berry mix. Instead of just picking your pumpkin seeds, get your 4-seed mix. So it's actually things that super easy to switch in, not taking an extra time or cost, but actually is going to fertilize more different microbes, which will give you more kind of skills and more functionality. So that's kind of, I guess, the general principle, what we're seeing come through the science, right? But I think there's a few additional things which probably haven't been captured in that. And that is things like fermented dairy and oily fish. So a lot of people initially thought that having, healthy gut meant plants only, but actually we see that fermented dairy, because of the different bioactive chemicals the bacteria produce through that fermentation process. So they take dairy, unfermented dairy, and get the proteins and the fats and the lactose, the milk sugar, and they convert it into different bioactive chemicals, let alone also adding extra microbes into your diet. So fermented dairy, I think there is good evidence out there to suggest that's got a pro benefit on the gut. So adding that in. And then, so whether that is things like your quality cheeses or your kefirs or your live yogurts, and then oily fish. And what I typically say, I know we're going to touch more into supplements, but if you aren't having at least 2 serves of oily fish a week, so things like your salmon, your
Sardines.
herring, your anchovies, sardines, mackerel, then you should actually take an omega-3 supplement because, again, we've got pretty good evidence out there to show that is having an additive benefit on the microbiome. So I think those sorts of things. And then obviously this whole world of ultra-processed foods is like unbelievable at the moment. And
Yeah.
we have just finished collecting or recruiting people to our clinical trial, which is now 5 years in the making. This is how long it takes research to kind of come
Oh,
through. But it's,
believe me.
the first clinical trial to ever look at, in the human, obviously, setting, looking at food additives, emulsifiers. So there's all these rumors around there saying that certain types of additives actually could have a negative impact. Now, if we think of additives as a category, right, there's over 400 of them. They've gone through rigorous testing, right? So, the government is wanting to look after us. They're not trying to poison us. But a lot of that testing was done before we knew about a microbiome. So actually, they approved it from the human cell molecular level, but actually didn't look at how it's impacting the microbiome because they didn't know about it. So actually the governments, around the world are starting to reassess the safety of these food additives. So our team's looking specifically at emulsifiers as a category. So there's about 60 different types. And they're found in like 20% of the foods we eat. Packaged foods are everywhere. And again, we haven't done the data analysis yet, but the preliminary kind of pilot studies which fed into this suggested that it's probably an individualized response firstly. So not everyone's going to react the same. Particularly people who are more genetically susceptible to gut issues might be more vulnerable. And we're specifically looking at inflammatory bowel disease, so Crohn's disease, where we already have a good basis that we know there's something in diet that's triggering a flare-up.
Is that genetic?
Genetic, yeah. So there's definitely a genetic component, but it's kind of three parts to it, right? So there's genetic, there's environmental, and the microbiome. So we know all three are doing something, but it's just trying to understand why. And so it's probably that we think maybe it's the environment that's kind of triggering it. Things like the emulsifiers, because how they work is emulsifying kind of, the oil and the water, they bring it together to mush it down. So we think the mechanism of action is the emulsifiers kind of eat away at the mucus lining. So make our gut lining more thin and therefore allow pathogens kind of through the gut, which normally would be blocked, and therefore can create that inflammation, triggering kind of the genetic downfall of people who are more genetically predisposed to inflammatory bowel disease. So
is it the same idea? We all have cancer cells.
Yeah.
And if our lifestyle and environment are really going to drive whether or not those cells become cancerous, become turned from. Is that kind of the same sort of principle?
I'm sure there's a lot of overcrossing mechanisms. If we look at the molecular level, they are very different. One's an autoimmune condition and one is more of the, the older cells that have kind of transformed in a negative way, so to speak.
Yeah.
But I think definitely there is that same sort of triage of like, yes, there's a genetic component, but also the environment's doing something, and even the microbiome. In fact, I think some new research has just come out showing that actually bowel cancer in young people is the rates, I think, in those under 50s, like doubled in the last like 40 or so years. And that highlights it's not just genetics, right? Because genetics can't obviously change that fast. Yeah. So there's something in the environment that's triggering this. So yeah, I think there's this whole new world. So what I think though is an important message is that we don't go too extreme, right? So what we're seeing from the literature, it's not, if you have a little bit of ultra processed foods with some of these emulsifiers, it's going to be fine, right? You've got to enjoy your food, because if you're super anal about food, that means you're not eating out with friends, you're not socializing very often. So actually that's going to have a negative impact on other elements of your life. So the concept is very much about inclusion, not exclusion, adding in as many different plants and the diversity, as well as the oily fish and the fermented dairy. And then if you have some chocolate with additives in it, it's going to be fine. Okay, there may be more research coming where there might be specific additives where it's like, actually, this is really something we should not have at all. Like trans fats, for example, we discovered, no one should have any of that, and now it's been banned. But I think at the moment, this is what I recommend not only for my clients, but my own family. So this is kind of where my head is at with it, with, a critical kind of review of the science to date.
I love that. What about grains? So I add barley to everything. I love it so much. Like, so I know fiber is important, right? But you hear on the internet, like, grains are so bad. I've even heard you need to set the record straight on kale. Should I eat kale?
You should eat kale, yeah. Not, okay. But this is what's wrong with society, but I get it. It's not like it's because everyone wants to be healthy and they want a hack that's going to game change them. Right. But the truth is, it is boring as diversity. So if you go and eat, 500 grams of kale every day, yes, that's going to be way too much, and that's going to off balance things like the oxalates and the anti-nutrients and all that sort of stuff, and therefore you're not going to absorb certain things, and that will only grow the kale liking bacteria, and therefore it's going to narrow them down and reduce the skills. So that's kind of, I think, where we go wrong, is we see one study or two study where they're showing benefit of a thing, then we just go crazy on it, ain't nothing but that. Where obviously, you would have heard of things like the lectins, right? So lectins as being like the worst thing in the world. We should not have lectins, and that's where that famous book that came out saying the plant paradox, whatever. We shouldn't be eating plants because they contain lectins in it. And actually, yes, the truth is that's the thing. The truth is always there's always a little bit of truth in something, right? That's why it validates it for a lot of people. But the thing with lectins is that having a lot of lectins, yes, is terrible. So if you ate raw kidney beans, and that's kind of where the initial research from lectins came out, where I think it was a hospital setting, they undercooked the kidney beans, they're quite chewy, and then people had an overdose of lectins. I think some person might even died from that, right? So it's quite acute. Then yeah, it's going to be awful. So if you eat loads of raw legumes, which you probably break your teeth in the meantime, and you know that they're not right, you don't prep them right, you probably know it's not going to be good news, then yes, that's going to be dangerous. But actually, more recently, studies have suggested that lectins in small amounts, mostly in test tube studies so far, actually have anti-cancer effects. So they work via, that mechanism. So anything in, moderation, boring, no one wants to hear that, but it's honestly the truth, right? So yeah, that's the thing with kales, the long-winded answer of your question.
Yeah. I mean, anything, consumed in like large doses seems quite intuitive that it's going to be bad for you, right? So yeah.
You also asked about grains, which I think is an important one to go down, because I totally get, a lot of people I see in clinic have gone paleo and they've cut out grains and stuff like that. So my take on it is that we are eating too many gluten-containing grains. Now, I have not seen any research yet that has suggested that unless you've got celiac disease, which affects about 1% of the population, or non-celiac gluten sensitivity, which is like gluten intolerance, which we think is probably anywhere between maybe 3 and 7% of the population, that gluten is having a negative impact. I don't think gluten is a health food. We need to have more gluten in our diet. But the reason why I think we're having too many gluten-containing grains, is that means that we're not having your quinoa and your buckwheat. We're not getting in that diversity. So actually we're just having way too much of the one type, the wheat. So actually we're only feeding the wheat lacking microbiome, and that's narrowing down the kind of that diversity. And when we again have that narrow diversity, certain populations start to dominate and they get a bit cocky and they can start being a bit pro-inflammatory. So yeah, I see the grains as actually we should be having, a diverse range of grains in our diet. We do see, from these large observational studies, that people who are having, a diverse range of grains in their diet do have a lower risk of type 2 diabetes, do have a lower risk of heart disease. So I think we've got good evidence on an observational level that having grains in our diet is important. It's that diversity of grains and also the form of grains, right? So, ultra processed grains is probably how most people are having grains, and therefore that's not going to be great because actually it's stripped of, I think it's like 20 different micronutrients when you take the fiber out of wheat, for example. So the wheat the whole grain containing wheat and the white pasta, so to speak. So you're losing not only those micronutrients, but then I'm sure probably another 100 types of phytochemicals, let alone the fiber, which is fuel for the microbiome. So yeah, that's kind of where I think my stance on the research is currently at.
I love that. It's super helpful. It's so funny to hear you talk about the gut biome. I feel like it's like a person. It has preferences. It has an attitude. It has do you have a name for your gut biome, Megan? Come on, I know you
know
do.
what? I don't actually have a name, alter ego. It could be my alter ego. But I am such a nerd, but I think it pays off, right? Where actually every meal I sit down to, even if it's a snack, I'm like, okay, what is on here for my microbiome?
Yeah.
And it's like, I think it's a way of thinking that we need to ingrain in kids from a young age. So even if they don't like their broccoli, their little pet or their little bestie in their gut actually loves it. And if they want to be a good pet owner or good friend, they should just, have a few pieces. And actually it changes the oral microbiome. I've done it to my husband. Like he's a medic, but he never used to eat plants. They do about 10 hours of nutrition in their whole degree. So I'm not surprised. But anyway, he hated them. So I used to just start to add them in without him necessarily knowing, the simple tricks of cutting out half the mince, adding lentils in, blending in mushrooms so they can't even see it. And actually his oral microbiome has now changed where he, has gone away on some bucks trips with, for friends and stuff and been a trashy diet. And he's come back and I can't even eat it. I just don't enjoy it. I feel sick. And so for those who don't like plants who are listening to this, trust me, you can train your oral microbiome to
Yeah,
enjoy them. And there's, clinical trials to back that up. Not just
I love
my
that.
anecdotal evidence with my husband that I like to throw under the bus occasionally.
Yeah.
What's up, folks? If you are enjoying this podcast or if you care about health, performance, fitness, you may really enjoy getting a Whoop. That's right. You can check out Whoop at whoop.com. It measures everything around sleep, recovery, strain, and you can now sign up for free for 30 days. So you'll literally get the high performance wearable in the mail for free. You get to try it for 30 days, see whether you want to be a member. And that is just at whoop.com. Back to the guests.
No, but I love that little conversation that you have with yourself, like I think about that too. I'm like, all right, what am I fueling for right now? I really try to think about the composition of my diet and the timing of my diet to kind of help me do whatever it is that activity
Yeah.
I'm doing next. I think about that in the context of my sleep, right? Is
Mm.
this meal right now, or is what I'm putting in my body going to help me do my next activity, which might in fact be sleep,
Yeah.
right? Or rest, or if I'm weight training versus cardio, I really think about fueling for my activity. And I think thinking about, all right, how is this actually enhancing my gut health is part of that conversation. And I love that framework. And I think that is going to be super helpful for folks. I want to get into sleep and then exercise. And I think we finish with supplements. So I look at, I study, I'm a psychophysiologist, but a lot of my work is in this area of circadian physiology. And so I look at behaviors like sleep wake time and how that impacts all sorts
Mm.
of aspects of psychological and physiological functioning. And one of the studies that drew my attention was this 90-minute difference in midpoint of sleep. So this 90-minute variability basically in kind of the midpoint of sleep is associated with harmful gut bacteria. It's just this notion that I think when we want to help people, or what are the practical things that I can do? All right, I've got this super six. I focus on that. You've got two beautiful books that kind of outline all of this. We'll put some of the stuff in the show notes as well. But also knowing that our sleep really contributes to a healthy gut biome, and there's actually an aspect of sleep that is really important. You mentioned duration and that beautiful study looking at sleep duration, and when folks are getting 4 to 6 hours of time in bed, that's negatively impacting the diversity in their gut biome. I think that's fascinating. And then in fact, sleep consistency matters too, sleep regularity. So making sure that we're not
Mm.
having huge amounts of variability in terms of our sleep onset and offset is another thing that we can control.
Yeah. Absolutely. So, I mean, in terms of that research, I think it's so fascinating, and some similar research, although it didn't directly look at the microbiome, by colleagues of mine in the nutrition department, looked at the
Mm.
impact of sleep on our nutrition, but also how to enhance sleep, right? Sleep
Mm.
quality. So they developed this sleep hygiene protocol. So it included, I think it was like 9 simple steps. So half of the participants got this sleep hygiene protocol. The other half just got general advice, sleep more
Mm.
essentially.
Yeah.
And they found those who got the protocol, they slept, I can't even remember the specific, maybe it was like an extra 30 minutes, and it was heightened quality. But also they
Amazing.
didn't, in this particular one I'm referring to, they didn't necessarily look direct, they didn't mention diet at all, but they showed that those who slept more also, I think it was about 2 teaspoons of added sugar less per day by just sleeping more. So it just shows how influential it is, and why it's
Yeah.
also connected, in other ways to the microbiome, because you're having more of these
Right.
added sugars and less of the fiber and all that sort of stuff. So
Mhm.
I'm sure people are like, well, what was the protocol? So from my vague memory, it is in my first book, because they were so nice. They let me publish the protocol, but essentially it's like,
Amazing.
as soon as you wake up, exposing your face to light, just
Yeah.
regulating your second, the simple ones, right? I think your room temperature being like 16 degrees, so actually
Mhm.
quite cold, kind of helps you
Yes.
get a better quality sleep. No phone time, like the blue
Mhm.
light thing. I think it's like 2
Yep.
hours before bed.
Amazing.
Meal times, not having a big meal,
Mhm.
having a worry diary, so literally brain dumping all of your worries into a book.
Mhm.
So you don't wake up at 2 a.m. like I often do with a great
Yep.
idea, or like, oh yeah, I needed to execute something and I forgot to, all that sort of stuff. And then, yeah, those sorts of things. So all really, practical things, but it's when you do them together and make them like a ritual, you can start to improve your sleep quality. And then we've got those
Mhm.
additional studies, like you mentioned, that then shows that has that knock on impact to your microbiome too.
Yeah. I love that. I think understanding, sleep at a foundational level is just going to is going to have the second and third order effect that impacts every aspect of
Yeah.
our kind of physiological and psychological functioning. And, getting that right is worth all the effort, and I think a lot of other things kind of start to fall in line to your point. Like, I think we crave less, you know, processed foods, right? When we're
Yeah.
well slept, and we have quality sleep. You mentioned scheduling worry, and I love that so much, and I recommend that to folks often when they're like, I just can't fall asleep, or we
Yeah.
notice in the data, someone's struggling, and they reach out, and we look at the data, and like, yeah, it's okay. Sleep onset is really a problem. It seems like your sleep onset variability there's lots of variability, but they'll tell us, oh, I'm in bed at the same time, but I can't fall asleep. And a lot of it has to do with just that stress accumulation throughout the day. Right. And
Mm.
I find scheduling worry is such a powerful, simple intervention that if it really does help with sleep onset and it helps with quality of sleep. So I love that you've highlighted that. What other kind of techniques? Well, number one, there's a connection between stress and gut health. So maybe just talk broadly. What is this connection? And what are maybe some other practical interventions people can deploy to kind of pay down that stress that will help sleep, that will help their gut biome? Yeah, what's the connection there?
Yeah, so we kind of briefly touched on these different pathways,
Mm.
right? How the gut and brain are constantly communicating. So, via, I like to think of it like the mobile phone, that enteric nervous system kind of zips up those messages
Yeah.
via the immune system, those inflammatory markers impacting, sleep in that way. And then obviously the snail mail, kind of where the bacteria actually produce chemicals, gets into our blood, and some of them can pass that blood-brain barrier. So that's kind of what's going on. And it's bidirectional, as
Mm.
I'm sure a lot of people have found that, if they're stressed up here, they can get the butterflies in their tummy, right? We've all
Mm.
experienced that butterfly feeling, and there's nothing, happening in the gut other than the messages that are being fed to it. And I think, a really good example of this gut brain kind of dysfunction is in irritable bowel syndrome. So, 1 in 10 people, if not more, probably struggle with some level of kind of this disconnection between the gut and the
Mm.
brain. And we never really understood it in any great detail until, I guess, more recently, where we now have like this diagnostic criteria for IBS. And, although many different things can cause IBS, including gut infection. So if you go away, travel abroad and get, a tummy bug, then you're a threefold increased risk of getting IBS in that subsequent year. But similarly, chronic stress and trauma can actually also cause IBS. But the underlying mechanism, the Rome Foundation do amazing work on this. They're the ones who kind of really lead the way, is this dysfunction between the gut and the brain. So it's
Mm.
not talking, not very, functional. So in terms of the strategies around that, we do know there's a diet out there. You may have heard of a low FODMAP diet, which actually is
Yeah.
not a healthy diet. It's really unhealthy because actually it cuts out prebiotics, certain types of fertilizers for the microbiome, but
Mm.
it is very effective in the short term. So people should only follow it between 4 to 8 weeks. And then they go
And
through a
that's
second
cutting out
stage.
dairy, right?
Yeah, lactose cut out, but
Lactose, right.
the main thing of why it's unhealthy is the fact that it cuts out prebiotics. So it cuts out your legumes, cuts out your garlic and your
Wow.
onion, and a
Mm.
lot of mushrooms, and so it cuts out your prebiotics, so your fructans, your lactose, but then also your polyols, which are found like avocado, and
Wow.
celery, and like a lot of healthy foods. But we know it works for
Mm.
moderate severe IBS. It's a
Mm.
medical diet, but then you go through the second stage of reintroduction and then get to personalization. So we've known that it's a medical diet, really effective. We use it for severe cases. But more recently, because of this science around the gut brain interaction, there's now been studies looking at gut directed hypnotherapy, literally talking therapy, where it targets this connection, so top down, and then also gut directed yoga flows, where they've put them to the test in a randomized controlled trial against a low FODMAP diet, that IBS diet, and have shown that they've got equal efficacy of reducing IBS related symptoms. So things like your
Mm.
stomach cramping, but also your bloating and your altered poops and things like that. So I know we
Mhm.
were specifically talking about in the sleep setting, but what I think is just a really nice kind of case study or example of how targeting this can probably help, with other elements, whether it is, that level of sleep, where we know that the microbes, if they're dysbiotic or unstable, they're probably going to cause you to have unstable sleep. So
Mm. Wow.
doing, 10 minutes of a mindfulness app. I don't know if Whoop has got a component of
We
mindfulness in
do.
it. Yeah,
Yeah.
amazing. There's really good research out there that
Mhm.
also helps via, or helps with, sleep quality, and a
Mhm.
mechanism could be because it's also impacting our gut microbiome.
Incredible. And you recommend the diaphragmatic breathing, right? So breathing from the belly.
Yeah,
Um, so
not the
just kind of
chest.
not the chest. Yeah,
Yeah,
slow
yeah.
paced diaphragmatic breathing.
Yeah.
Okay.
And people,
Diaphragmatic, I should say.
yeah, exactly. And people who struggle, with food and in terms of digestive symptoms, doing diaphragmatic breathing for like 5 minutes before a meal,
Mm.
it sounds super simple, but it can game change. A lot of my
Wow.
clients who are struggling with altered poops, bloating, reflux, which is, about 20% of the population at some point is going to struggle with that. So, tapping in to this gut brain connection, it really
Mhm.
reduces down that over excitement of that enteric nervous system, which like strangles the gut. So like
Right.
what a lot of people with gut issues are like, I can't pinpoint what my trigger foods are. And it's like, because it's feeding in sometimes from here. So no
Mm.
matter what you feed your gut, any sort of activity, even if it's a very like bland food, can move the gut. And therefore these nerves that are like really heightened because of this is stressing them like live wires, it's going to
Right.
activate your gut symptoms. So
Right.
it's not necessarily just what you eat, but what's going up in here.
So basically, when you are stressed, that is going to manifest in your gut and and influence how the microbes in your gut
Food.
activated or metabolizing food. Okay.
Yeah, yeah.
So basically, I think so. What it sounds like from a mechanistic standpoint, we're activating the parasympathetic branch of the nervous system prior. We're almost like priming our nervous system to eat.
Yeah. It sounds so simple and so
Uh,
obvious, right?
it's so
Um,
obvious.
but let's be
Damn.
honest, we all live very busy lives, and the
Totally.
thought of that 5 minutes can be a bit overwhelming. But if it means, you're not going to suffer with these really burdensome digestive symptoms, then it's
Yeah.
worth doing. And, while we're there in terms of how we eat, chewing our food, like so boringly basic. But they've done, clinical trials again, and they've shown that chewing your food more, you know, increases your nutrient absorption quite significantly. I think it's like 15% of your nutrients you absorb. So if you're
Holy
only
cow.
chewing, yeah, if you're only
That's
chewing foods
significant.
like 10 times, you malabsorb a lot of that nutrition, because we don't only start to physically break it down, but we have the enzymes in our saliva which start to chemically break
Wow.
it down.
So for a typical bite,
Yeah,
what is my average chew? So how
probably
many
less than
more times?
10 for the average
Less than
person.
10.
But yeah, so what the clinical
So
trial did,
if
it was
people just think about, all right, if I add 3 more
perfect
chews, is that
per
like kind of
week, per week. And try build it up to get, obviously it depends on the consistency. You're not going to chew bread, a really soft bread 40 times. But the clinical
right?
trial looked at nuts, right? And they showed 10 chews versus 40 chews, and 40
Is this
chews
the
had like,
almonds?
40
Mm.
almonds. Yeah, you've probably seen
I
this.
read that. Yeah, yeah, yeah. I love it.
So exactly what you said. Add an extra 3 chews on per week if you can. And then if you're good there, then add an extra 3 on to get to at least, I would say, about 20 chews per mouthful is probably, for, a standard consistency of food, is probably optimal. But yeah.
Amazing. Any supplements folks should be aware of? Like what are the ones that we're just like there's no evidence whatsoever that these
Yeah.
things are helping with gut health?
Oh God, there's a lot of different supplements on the market.
Yeah.
I would say probably where there's no research and I see a lot of people having them, so I say save your money, is these like broad spectrum digestive enzymes. So a lot of people who struggle with gut issues, go on them, which mechanistically it makes sense. You're like, okay, I must be not having enough of these enzymes, and therefore I'm malabsorbing food, and the bacteria ferment it, and that's why I'm getting these gut
Mm.
symptoms. But unless you have pancreatic insufficiency, which you'll know about because you'll have severe symptoms, where they actually do recommend, or not recommend, they prescribe these
Mm.
high dose broad spectrum digestive enzymes, essentially to make up for your pancreas. And the brand people probably heard is Creon. They work so effectively, life-saving, but you need to titrate it to what you're eating. Whereas these ones over the counter, there's a real lack of clinical evidence that suggests they have any benefit. So what I recommend is actually you need to identify, what are you deficient in? Is it, you can't digest lactose and therefore you take the
Mm.
lactase enzyme? Or actually do you struggle with beans? In which case I do really believe you should teach your microbiome to digest the beans more effectively. But in the short term, you might want to take the digestive enzyme alpha-galactosidase, which helps digest the component of beans known as GOS or galacto-oligosaccharides, which you're struggling with and causing a lot of gas and upset. Similar with fructose or xylose isomerase, you should take the specific enzyme that you're kind of lacking. These broad spectrum ones, I would say, there's a real lack of kind of evidence for. And then I think this world of pre and probiotics, we have to obviously touch on that. We're talking about gut health, right? It'd be wrong not to. So totally. Prebiotics is the fiber. So not all, they've changed the definition. It used to be just fibers. Now they're thinking actually some other types of phytochemicals might also be called a prebiotic, but that's just, the science jargon. But essentially they fertilize the microbiome. But I say if you're getting in that, you're super sick most days, eating really diverse range of plants, you're going to get enough prebiotics, that fertilizer in your diet. So prebiotic supplements in the market is just going to contain one or two of these prebiotics. You're not really going to get that diversity. So I rarely recommend a prebiotic supplement, if I'm honest. Then probiotics. So these are those live microorganisms. And that's actually what I did my PhD in, is looking at symbiotics, pre and probiotics. And the thing about probiotics, it's just completely misunderstood how we should be using them, right? So there's actually no evidence on the, out there that suggests we should take a general probiotic for good gut health on the daily basis, right? And it makes sense because the probiotic's kind of like a drop in the ocean. But that's not to say probiotics are a waste of your time and money. We just need to start using them the way that they should be used. And that's kind of condition specific. Because there's, like I said, thousands of these different types of bacteria and they all do different things. They've got different skills. So like if you have iron deficiency, you're not going to go and take a vitamin D supplement and expect your iron deficiency to improve, are you? They're different nutrients. They do different things. Exact same with probiotics, right? So an example is if you have to go on antibiotics for whatever reason, obviously we don't want to go on them all the time, but they can be life-saving. Sometimes you just have no choice. Then there's really good evidence and it's guidelines that you should take a specific probiotic called Lactobacillus rhamnosus GG. You would take it at 10 billion units twice a day throughout your antibiotic period and for a week after. So we know that medications, a lot of them are impacting the microbiome. Now, actually, a very small subset we think might have a benefit. That might be the mechanism, like metformin, that's often used for type 2 diabetes, might be how it has its benefit, is it targets the microbiome and does beneficial things to regulate hormone, regulation of insulin and appetite and all that sort of stuff. So it might have a benefit. But actually, we certainly see it with things like PPIs, right? So PPIs are so overprescribed. So many people on it, and they don't even have that effect for a lot, that benefit for a lot of people. They just take it, they'll prescribe it once and they get stuck on it. And even though it's not helping with their reflux any great deal, they stay on it. Or actually, if they just, change their lifestyle, reduce down their food triggers, maybe lost a little bit of weight, stop smoking, drinking as much, sleeping slightly elevated, all of these things which we know we can help with reflux, they might not even need the PPIs. But we know the PPIs change your microbiome and makes you more vulnerable to gut infections. And we think maybe that could be why like SIBO, small intestinal bacterial overgrowth, is on the increase. We see a correlation there. So, I could go on and on about that.
People might not know the acronym for
small intestinal. Small intestinal bacterial overgrowth. Essentially, we've got this 9-meter long digestive tract. Most of our microbes live in that last 1.5 meters, the large intestine. And there's this little trap door that kind of prevents a lot of the microbes from getting from the large intestine into the small intestine called the ileocecal. And what happens is that for whatever reason, it might be the PPIs have changed kind of the profile of the microbes. Could be your gut movement is not as effective. The little door opens a bit and means the microbes can crawl up higher into the small intestine, and the small intestine can't deal with a lot of these microbes as effectively. So it can cause a lot of bloating, altered stools, and all that sort of stuff. We could talk a whole podcast on SIBO and IBS and that, but just, I know that's a bit of a tangent. But yeah, I think we need to start thinking about actually, can we get on top of the condition or the disease or the symptom via diet and lifestyle? It might be a little bit harder than taking a pill, but trust me, in the long term, it will pay back in dividends by grief, the grief of premature death or disability, all of this sort of stuff that people don't really think about at that very time.
Yeah. So you have someone come into your practice, let's say, and how do you think about exercise as an intervention for improving gut health?
Yeah.
What's the connection? What's the mechanism there?
Yeah, really cool. So independent of diet, and I like to make that disclosure because a
Mhm.
lot of people, like I said, fixate on diet.
It's
So
all connected. Yeah.
yeah, they control diet. So there's something else going on with exercise. In particular, they think more like endurance exercise, like cardio
Mhm.
versus strength training. Particularly, I think is where the research is at. Maybe it's because we haven't done a lot of strength training, research on the microbiome. But most of the research is suggesting, 3 times a week, at a moderate to high level intensity seems to be correlated with a more diverse microbiome. And it's been actually in an intervention study also kind of to confirm that. I guess in terms of the mechanisms, we haven't completely discovered what the mechanisms are. It might be because when you're exercising, you're more likely outside, and where there's millions of bacteria floating in the air, so you're exposed more to microorganisms that way. It might be because actually when you're exercising, it changes the gut motility, the gut movement, and therefore exposing the microbiome to different types of fertilizers. And then also there's a thought that perhaps like lactic acid might actually be a bit of a prebiotic for the microbiome. So actually feed some of these beneficial microbes.
Interesting.
And I think there's this whole very exciting world of gut health for athletes,
Mm.
where you've probably seen the research where they looked at the Boston Marathon runners and the stars, the winners, and what they looked at is their microbiome, and they had specific types of strains of bacteria that was more effective at metabolizing lactic acid and turning it into an energy. So they had less muscle burn, therefore could go longer. Um,
Whoa, that just gave me goosebumps. Wait,
yeah,
what?
yeah,
Holy,
I know.
that's insane.
So they're now looking at trying to understand that more. So there has been follow-on studies where they've taken
We
these.
need to bottle those strains
I know
so we can
exactly. I mean,
I'm
everyone's
like,
like,
"Can I have that?"
and they've done that, and they did it, and they put it in animals because obviously we like to start in animal studies, and
Mm.
they showed those who had those specific strains extracted from those marathon runners. They then did like treadmill running, and I think it was 13% increase in their performance output or whatever, which for an
Mm.
athlete, 13% is huge, right? Now, I think it still probably is early stage, but what my not concept, but my theory around this is that we will be looking at elite athletes, ones who are just like crazy good at something, where like even without loads of training, they just, I just excel at a sport. And
Natural
everyone's like,
acumen.
how is this person so great?
Mhm.
They will take their stool and they will develop, a fecal microbiome transplant. So have you heard of the stool transplants? Yeah.
I sure have.
Um,
Yeah, one of my former colleagues has IBS and got a fecal transplant. It felt like $1,000,000 afterwards. It was
yeah,
insane, the positive
interesting.
impact. Yeah.
Because there's a lot of studies in IBS, because we've considered it King's, and some of them have shown no benefit of fecal
Mm.
transplants in IBS, and others have. So we think there's like these super donors. So it really depends on whose stool
Wow.
you're getting. And
Wow.
I always say a caution because in London, I don't know, it might be similar to where you are. There's actually microbiome transplant clinics running privately, and I just say, whoa, 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 wait up, because we're seeing
Wow. That's
studies mainly in animals, but we're transplanting things like depression. And the donor of these stool samples might not be declaring that they've got a family history of anxiety or depression. So you might, improve your IBS perhaps, but actually gain something that you don't want to get. So I'm just always
wow.
really cautious that only stick to clinical research
Mm.
for transplants because they have to screen them. But I think there will be a day where we'll take the community of microbes and put it in a pill. So it's
Mm.
probably not going to be just one magical type of strain. It's probably the collection, because I think, what we're seeing is, like I mentioned at the start, is different bacteria act different in different environments. So if you're just putting one in there, but it's not the right environment, it might not eat the lactic acid and be as effective as if it was in a different environment. So you need kind of the combination.
It's phenomenal. You mentioned resistance training, and I'm super passionate about improving the quality of the muscle tissue, and I
Mm.
wonder if that's actually the mechanism, because there is in fact a gut muscle axis, right?
Yeah, yeah.
Like that, there's like a really strong connection. It's interesting
Yeah,
that
they
there's
produce
a lot of
amino
research out there.
acids. Yeah.
What's that?
They produce amino acids as well, our
Right.
microbiome. So yeah, there's so much in there. So I'm sure resistance training, clearly it's proven to work. One of the things that you're doing, not being sick in 10 or so years. So
Yeah, I think, well, I know a lot of muscle people, so if, you're interested in and more research in that area,
yeah.
I've got a lot of people who'd be interested in collaborating. This has been just an amazing conversation, and I learned so much, and, just appreciate all the good work that you're doing in this space. So thank you.
No, thanks for having me. It's been so much fun, hence my rambling. I've had too much fun.
I know. Thank you.
Big thank you to Dr. Megan Rossi for joining us on the Whoop podcast. She is, of course, the gut health doctor. If you enjoyed this episode of the Whoop podcast, please leave a rating or a review. Please subscribe to the Whoop podcast. If you don't have a Whoop, you can check it out at whoop.com. Sign up for a free 30-day trial, get the hardware and the whole experience for free for 30 days. And that's it, folks. That's a wrap this week. We'll see you next week on the Whoop podcast. As always, stay healthy and stay in the green.